Now that you're familiar with the most common types of monitoring used in the PICU, let's wrap up this series by talking about 2 additional monitors you may see in specific patient populations. This video will discuss Solmonetics, or NIRS, and ICP monitors. Solmonetics uses near-infrared spectroscopy, or NIRS, to measure regional oxygen saturations. Stickers, such as the one shown on this patient's forehead, provide continuous measurements of end-organ perfusion. They're most commonly used to monitor cerebral oxygen saturations in infants following cardiac surgery, but can be used in other populations as well, such as kids in shock. In our unit, we generally monitor cerebral saturations, but the stickers can be placed over other organs, such as the kidney, to monitor perfusion there as well. NIRS readings tend to correlate with SpO2, so the values are usually around 25 points lower than arterial saturations. As with many of the monitoring modalities we've discussed, the trends are most important, so it's good to know where your patient normally sits so that you can identify any big deviations from their baseline. A screen such as the one shown in this photo will sit at the head of the patient's bed and will show simultaneous readings from both stickers, whether they're on the left and right side of the forehead or the brain and the kidney. For our last monitors, let's talk about ICP. In patients with TBI or other neurosurgical issues, we can monitor ICP, intracranial pressure, via 2 different types of intracranial devices. The first is an external ventricular drain, or EVD, like the one shown in the left photo here. The EVD is placed in the OR and can both monitor pressure and drain CSF. EVDs are leveled relative to the external auditory canal using a transducer like the one shown in the middle photo. Neurosurgery will raise or lower the device to control the amount of CSF it drains. In patients who are too unstable to travel to the OR, a bolt or intraparenchymal pressure monitor can be placed at bedside. A bolt can't drain CSF, but can provide a continuous ICP measurement. EVDs are left open to drain the majority of the time, but closed intermittently to record pressure. The open ICP is recorded continuously and appears on the telemetry monitor at the patient's bedside. However, only the closed value is meaningful, as you can't actually measure pressure in an open compartment. Be sure that you take note of the closed ICPs from EPIC and report those numbers on rounds, not the open measurements. A sustained closed ICP greater than 20 is cause for concern. ICP also contributes to the CPP, or cerebral perfusion pressure. CPP equals the map minus the ICP, and you'll learn more during your rotation about why this is important and what numbers we target in different age groups. That concludes our monitoring series. Although there are certainly other devices that you'll see during your rotation and other sources of the incessant beeping here in the ICU, you should now be able to recognize the majority of your patient's monitoring accessories. Thanks for watching.